So for those that don't know, high level, because we got to work through a lot of products today. Those that don't know, semaglutide, Ozempic, Wegovy.
Hmm.
How's it going to work?
Yeah.
Just high level. What's it going to do for the patient? How's it going to allow them to lose weight?
Sure. So it's a glucagon-like peptide. It's an insulin mimetic, so it will cause you to secrete insulin when your blood sugar is high. The end result really is to reduce your cravings, decrease the amount that you're driven to eat. And, one thing that we really, really want to reinforce is that semaglutide works great in helping you manage your portions and realizing, maybe I don't need 3 cups of coffee with all the sugar in it, and taking that you learned during whether it's your 16, 12-week protocol and incorporating that into the rest of your lifestyle so that you retain that weight loss. But like you said in the very beginning, curbs your appetite, helps, maintain your blood sugar, which is why it was, of course, initially a drug for diabetic patients.
When you talk about curbing appetite, just for the audience, I'll just share a personal experience and what patients tell us. You just stay full. So all of a sudden you're eating a normal sized meal and you realize I cannot finish this. Then your desire for food 3 to 4 hours later, typically those of us that would exercise and those people trying to lose 50 are going to be walking and exercising. You're ravenous, right? Hours later, you're just starving. Yeah, you just still feel full. And mealtime passes by and you don't even think about food. I don't know if it works on the mental aspects of food or if it's just the slowdown of the gastric emptying. Is there anything that it does in the brain to shut off a desire for food, or is it all slowing of gastric emptying?
So you don't have you have GLP-1 receptors all over your body. And meanwhile, it doesn't act in the same way like a stimulant might. It doesn't act on your pituitary in the way that psychologically it would.
Right.
However, the gut-brain axis is increasingly, becoming more well-studied, and the relationship between how your stomach interacts with your brain. So delaying GI emptying, which is a product of glucagon, will relay that sort of signals to the brain. So meanwhile, it might not be acting on the brain in the way like an appetite suppressant would. There is like a secondary
a little bit of a lack of desire for it. The same. Excellent. So semaglutide, Wegovy, Ozempic, awesome and amazing for those that really need to lose some weight. Even someone maybe we're writing it at our clinic for people who don't have 50 pounds to lose. They have 25 or 15 and they're struggling and they're getting there really quick.